Hello and welcome. Due to regulatory restrictions, in vivo toxicity studies cannot be entirely replaced by in vitro studies yet. For bioethical reasons, and if replacement is not able, it is the responsibility of regulatory toxicologists to at least consider options for refinement and reduction. Today's speaker will talk about how a reduction of animals used in reproductive and developmental toxicity studies can be achieved. Our speaker is a distinguished and highly regarded toxicological researcher and experienced in reproductive and developmental toxicity studies. Dr. Yana Kolianchuk has been the lead scientist for combined reproductive and developmental toxicity studies before joining JAKSCH Life Science Consulting as a regulatory toxicologist. Ladies and gentlemen, it is a pleasure to welcome in our names my colleague and friend Dr. Yana Kolianchuk.
Dear ladies and gentlemen, my name is Yana Kolianchuk and I am a biocompatibility and toxicology consultant and JAKSCH Life Science Consulting. Today I am going to talk to you about the work that will be presented at the ESTIV Congress 2022. This work focuses on the reduction of animal usage in reproductive and developmental toxicity studies. Nowadays, in vivo reproductive toxicity studies can be entirely replaced by in vitro studies. However, new methods can be adopted to reduce and refine in vivo studies. Compliant with experimental bioethics and 3R principles, we present here a new methodology approach that refines reproductive toxicity studies and developmental focus on teratogenicity toxicity studies by reducing the number of animals needed and optimizing for maximum empirical endpoints assessments. There are two main OECD guidelines for reproductive and developmental toxicity studies of chemicals. It's OECD 443, Extended One Generation Reproductive Toxicity Study, and OECD 414, Prenatal Developmental Toxicity Study. Of course, there are two different studies with different methodology procedure. The main difference are that exposure period in a reproductive toxicity study is much longer and takes the overall lifespan of animals. Throughout the gametogenesis, pre-mating period, mating and pregnancy period, and could be prolonged through lactation and maturation for the next generation. In developmental research, the exposure period takes nearly 2 weeks from the implantation and through a period of organogenesis. In two of these separate studies is used a lot of animals. For reduction of animals use, we propose the next scheme of experiment. It's a combined reproductive and developmental toxicity study. Using and considering OECD requirements, toxicology database, literature review, in silico modeling tools, and read-across approach, we can combine two of these studies in one by toxicological expert judgment. With this combination, animal usage will be up to 15% of adults and 35% of fetuses. Toxicology experts should be exact at a few essential points about the scheme of an experiment to conduct a combined study. First, it is about the exposure period, and in this case, the level of used dosages usually is different in those two studies. And in reproductive research, it is much lower. But suppose we know some information about toxicity and use the dosage from the tox database, repeated dose studies, or screening reproductive toxicity studies, and so on. And in that case, if possible, we can provide the experiment with similar doses to define NOEL and LOEL levels for reproductive and developmental toxicity. The next important thing that we should consider is the chemical influence on implantation when providing exposition through all pregnancy period, which is a critical part of the development studies because it could impair the lower number of fetuses for further evaluation. It was two essential points. If we are talking about refinement, then this methodological approach also refines reproductive and developmental studies by optimization of some experimental setups. It's a shorter experiment duration, fewer experimental tests, maximal parameter evaluation, and possibility to assess sex sensitivity. Because in this scheme, the experimental animals mate with untreated intact animals. With this, we also cover the requirements for developmental study, where females should mate with untreated males according to the OECD guideline. Another benefit from combined study is that the data derived from these tests can allow the determination of no observed adverse effect levels and lowest observed adverse effect levels for the various endpoints such as for prenatal toxicity, systemic toxicity, reproductive toxicity, fetal toxicity, developmental toxicity, and teratogenicity. At this point, we are far from complete replacement in vivo study to in vitro. Implementing reduction and refinement is essential as two of the 3R principles. The crucial benefit of combined research is animal use reduction and refinement with optimization, maximal endpoint assessments. Thank you for your attention, and if you have any additional question, please don't hesitate to contact us. Bye!
Yana's work and the poster is presented at the ESTIV 2022. If you want to learn more about this topic, please download the poster or recording via the provided link. Or feel free to reach out to the JAKSCH Life Science Consulting. Thank you and goodbye.